Good afternoon. Welcome to our second to last session on our Kin Mobilization Learning Community. I want to thank everybody who's been participating along the way. And for those of you who are just joining us for the first time, my name is Melissa Devlin, and I'm the Assistant Director here at the Grand Families and Kinship Support Network here at Generations United. And before we kick off, I just want to let you all know that I'm going to put in the chat a link to our website. If you're not familiar with us, you really want to be, and please visit our resource library. And we have access to previous events and webinars that we've done as well. We also have our Kin Finding Toolkit that was authored by Marina Nitsa, who is with Child Welfare Playbook, and that was compiled based upon practices that are going on across the country for kin finding, kin mobilization. So if you've missed any of our sessions, you can take a look at that. And also, I'm going to provide you with a link to all the past recordings and handouts from all of the previous sessions as well. So you can catch up along the way. If there's a particular topic you're interested in, please feel free to review those recordings. We are also here at the network available to help with any support around implementing any of these strategies. All of our assistance is free of charge. You just need to complete our technical assistance request form, and we will follow up with you, and I'll make sure that we put that in the chat as well today. Finally, we want to make sure that this is interactive and helpful for you. So again, this is not necessarily a webinar, it's really more of a learning community. And so what that means is we want you to ask questions or feel free to chime in if you have experiences or challenges on this topic to share with others. And you can also either just unmute yourself and ask a question, or you can put your question in the chat and we will get to it as soon as we can. So with that, I would like to turn it over to Emma Craig, and also I'm not sure if Linda Blancanto is here, but welcome. Thank you so much. And today we're going to be talking about raising awareness of the importance of kin early on. And so I will turn it over now to Emma. Thank you.
Thank you, Melissa. And thank you for inviting us back. I'm with you. I can't believe this is the second to last session. This has been such a rich, ongoing conversation and set of supports we hand out throughout. So thank you. Yes, I'm Emma Craig, and my colleagues Linda Blancato and Shireen Ashley are also both here with us on the call today. Shireen will be dropping some things in the chat throughout our time together. Like Melissa already said, we hope that this will be an interactive time. We have some prompts and hope to hear thoughts from you throughout as we talk about today's topic. I wanted to very quickly, in case you haven't joined a call with us before, in which those of us at Government Performance Lab have helped facilitate, the Government Performance Lab, or GPL, as we like to call it, is a research organization based out of Harvard's Kennedy School of Government. And we support jurisdictions in their journey on building more just and effective service systems for the folks that they serve. And we do this in a lot of different policy areas in a lot of different ways, but all of our work is focused on working very closely, shoulder to shoulder, we like to say, in supporting jurisdictions develop and test new promising practices to improve their systems and improve outcomes for their residents, and then use these experiences to raise up or lift and share best practices in different settings across the country, like a kinship collaborative call. So we love these sort of settings and getting to share out and learn more from you all as we go. Like I mentioned, we do this in a lot of different policy or social service focused areas. Both Linda, Shireen, and myself all work on the children and families team. And on that team, we see kinship and prioritizing kinship care as being a pivotal piece of building better systems for the families and communities that we serve. And in addition to myself, we also have two folks from San Diego County, which is a jurisdiction that we've been working very closely with this year, who I know have been thinking and working a lot about today's topic. So Mariah and Stacy, could I get you to come off mute and say hi really quickly before we jump in?
Hi, I'm Stacy Holloman. I'm the Chief of Agency Operation for the Emergency Response Program here at the Child and Family Wellbeing in San Diego.
Hi, I'm Mariah Williams. I'm Program Coordinator for Kinship Care and Community Engagement Support. Good to be here.
Thanks, Mariah and Stacy. And I'll get us started on today's topic, and really appreciate you all dialoguing with me throughout as we talk about the importance of raising awareness around kin early on. And to do that, I wanted to do a little bit of table setting or orienting ourselves in how we think about kinship care and why not just prioritizing kinship, but doing it early is so important and can make such a big difference. I know in many ways I'm most likely preaching to the choir in terms of who is a part of this call. And so please, as we talk through things, you'll see prompts in the chat throughout. Please also share with us how you've seen these pieces to be true in your own work and practice or with families that you've served. But when we talk about building kin first systems and the importance of building a kin first culture, we're not just talking about thinking about kin in the name of making a placement in the case of a removal, right? That is a piece of it. But we're really thinking about how can we build out that support network for every child and family that we're working with from day one. And we think about this as moving from a single placement approach to a network building approach in how we support the children and families that we serve. And on this slide here are a couple examples of just the many ways that we know that relatives and fictive kin play such crucial supports to children and families or other kinship caregivers before, during, and well beyond the life of a case, or well beyond the point where you might have interaction with them. And so in addition to thinking about working early on to build out those networks in the name of being able to make a placement with kin, we're also thinking about how can we start sooner in order to build out the network for the child so that they are able to stay in touch with or connected to what's theirs, their culture, their community, people who they feel close to, whether that's a weekly phone call, whether that's occasional transportation or respite support, which would help their caregiver as well. There's so many different ways to think about tapping into and building out that larger network. And so I wanted to do a little bit of table setting here for us to be thinking about this network building approach in our conversation today. Mariah or Stacy, is there anything that you would add here, or any examples of one of these pieces that you've seen to be true in your practice in supporting families in San Diego?
I think for us in emergency response, it's just the doing this from day one. You know, historically we did it early, but not as early as day one. And so for us, things are so quick in ER when we're able to start this process and get it rolling, and it's kind of working in the background while we're doing all the other investigation work. That has really helped. So I think that's something really big that we are seeing as a success in ER.
Yeah, and I'll just add that, with a focus now more on prevention and really building up a family system so that they can remain together, remain in their homes, their children in their homes. Family finding, early on can mean that a removal doesn't even happen, that a family is supported, and that a child stays in their home. And so having other family members, other relatives come in and support and bolster up that family has effects that are like really, really far reaching very early on even.
Yeah, those are great points. And that tees us up really nicely for this next slide around diving in even deeper into thinking about why it matters. But I also would invite folks, I don't see anything in the chat yet, but if other folks are thinking about other examples of how kin can play a role or support a child and family early on that you've seen, please share that with us as we go. And as we continue to think about the why and the heart behind why this matters, I think, Mariah, what you just shared really touches on these first two components here, right? On thinking about not just thinking about kin, but raising awareness around the importance of kin early on is a way to center the preservation of family, culture, and community throughout that entire experience within any sort of interaction or any sort of role that one of us might play in being a part of that family's life for a discrete period of time. Within that, honoring the preservation of their family's experience and all of those connections within, just as a foundational idea being important for that family. To go even further, we think about, in doing that, like Mariah said, yes, like this could very well be a way to prevent a removal. This could very well be a way to figure out a setup in which that child is able to remain with family members or with a trusted loved adult and within their own community. I think that we know this is important for anyone, but thinking specifically about communities who have been historically disproportionately impacted by the child welfare system, this is an empowering step or change or switch, right? Thinking about how to keep more families in their own community, more children connected there. And then thinking about other ways that raising awareness on the importance of kin can make a real difference early on. We've talked about maybe it's going to prevent a removal. Maybe there will be a point in which there is a temporary removal, but as Stacy talked about, and starting sooner, that can increase the likelihood that in the case of a temporary removal, that child is able to stay with kin because we've paved that foundation, we've built those relationships, we've had those conversations. And I think it's important to say not just that it's possible, but that it's possible to make that placement sooner rather than later, so that that child isn't jumping around in the interim. And also so that we're best equipping our kinship caregivers from an earlier point. I'm going to pause there. Are there other things, Stacy and Mariah, that you would add, or an example of any of those that I just voiced over?
So the one thing I wanted to add was that we're seeing is as we're having our staff kind of talk about this early on, it's also leading our families through the process of being able to identify those support people, whereas they may have thought they didn't have much support, but as we're kind of digging in a little deeper and asking, well, who could help take the kids to soccer, or who can they go visit for a couple of hours on Sunday to maybe give some respite. So if we're asking those questions, it's kind of allowing the family to sit and think a little bit about what support they do have. So while we're building our kind of possible kin to use on our end, it's also a way to kind of highlight for the family that they do have support, and this is kind of how their support can help. So that's been something we've seen as well.
Yeah, and I'm jumping in, Mariah, I was just thinking that connects so beautifully to Heidi also dropped in the chat previously how kinship caregivers can offer great support to families or to parents specifically in crisis. To that point, Stacy, of thinking about, yes, supporting that interaction and facilitating that when possible is a great asset for those parents, for that family. So I just wanted to reinforce, but go ahead, Mariah, sorry.
No, I just wanted to share because I mean, we're talking about, finding kin early, making a placement if possible, and if not possible, then at least keeping those permanent connections, keeping kin in a youth's life. And so here in San Diego, our PPAU team, I'm going to think about what that stands for, Permanency Planning Assessment Unit, Stacy? Yes? Okay. Okay, PPAU team, they work to find parents. And I think most child welfare units or places have a team similar to this. So we're looking at toward the end of the case as we are approaching termination of parental rights. We're thinking about that's the way that the case might be going. The PPAU team steps in to find missing parents that have we don't know where they are. Usually it focuses on missing fathers. And so there have been instances when we find a dad, an alleged father. This one case in particular found the grandmother, so the alleged father's mother, and called that grandmother to just ask if she, could help us to locate her son, and she did. And he didn't know about the child. And so in San Diego County, we asked that the father make an appearance in court, a special appearance, to then establish paternity. And in this case, the father didn't know and wanted to be a part of this child's life. And when we think about, in this case, I don't know how long the child had been in care at that point, but what could have happened if we had found that father earlier in the case? What kind of relationship could they have developed? Could the child have been placed with their dad all along? Could they have developed a relationship with their grandmother, other aunts and uncles, cousins? All of this whole side of the family that was, quote unquote missing, which if you follow Kevin Campbell, he says that family is not missing. We just have not found them. They're not missing. They exist. And it's up to us to make those connections. And so when we think about the importance of doing this early on, like obviously before parental rights are terminated, we want to do all of our efforts to try to find missing parents. But what if we had put that energy up front in that case and connected this young person with their father to start to make a connection and maybe reduce some trauma that the child faces? And when I think about and we didn't go over the importance of kinship here, I think because this group already is bought in. You don't need to know the importance. Everybody here is on board. But when you think about a child going with a stranger, like being placed with a stranger or in a group setting, how traumatic that really is, even if it's for one night, even if it's for the first week. How traumatic is that for a child or for any person, for myself, at my big age? I don't want to necessarily stay with a stranger, right? And so being able to connect, and I don't want to belabor the point, but just being able to connect young person as they come into care with kin, and hopefully folks that they have a relationship with already is just really, really important.
Those are excellent points, Mariah, and I'm with you on the stranger part. Yeah, I was going to, yes, Glenda, I see a raised hand here.
Okay, so I also think that, when we're looking for placement for these children, and, mom and dad have given us, we've helped fill out the genogram and so forth, and they've given us potential placements for the kids. And when we are calling these people, I think sometimes we get so focused on placement that we're forgetting the other aspect of it is support. So we had a child that did wrestling. So, it's a simple question. Okay, if you can't take placement, can you go and watch his wrestling matches? Because it would really, he's already going through a lot, and the trauma that he's going through, having friendly faces on the bleachers watching him could help. So I think being aware of that and having those conversations too. It's not all about placement, because a lot of people always say no, but.
Absolutely. That's such a great point and example, and really goes back to and we're thinking about those different places, that emotional support, belonging, that can look very different in lots of different examples. And that really resonates with me here, thinking it's easy to get not stuck on, but just focused on the placement option, especially if you're not starting early, right? I think that only escalates if we're to a point where, right, then removal is imminent and we just have to figure out what's happening next, versus if we think about starting sooner, having the time, space, and bandwidth to better get to know that family, to better think about building out those additional support opportunities. And I think that some of these other chats that I've seen, comments I've seen in the chat really connect to what we're saying here as well. Yes, Denise, I'm seeing say it does take a village. So the sooner the better. And yes, Melissa, thinking about to that point, it's not just in the moment making that single placement, it's thinking about building and maintaining those lifelong connections for the child. So thank you for that example, Glenda. I also wanted to go back. Sherry, I saw you in the chat earlier. Sherry said, let's see, something about everyone coming together early to ensure the child's first placement is the best and only placement. And that's a really powerful statement, and I think a great goal and thought. I also know that that's something that Stacy, your team, has thought about and been focused on in work and re-upping and really prioritizing initial kin placements. I was curious if you wanted to share anything there about what you've seen and helping make a difference, setting that your staff up to make that possible.
Yeah, that's definitely what our focus is right now, and having, the initial investigator kind of start this at the very beginning has allowed us to keep kids together, including large sibling sets, because we know our resource homes, it is hard to find a resource home that can take a large sibling set. So our focus is, let's look at all of our collaterals, all of the relatives that we know about, and let's start seeing what our options are early on, so that we can keep these kids together and with family, because like Shireen said, we don't want to move them around placement to placement. We just had a really good success of a sibling set of 7, who from the beginning, it kind of looked like we were going to have to go towards a removal. A lot of work had to be done, but there was just that kind of undertone. So we immediately sent it out to our placement team. They did amazing work. The parents weren't overly cooperative with us, so we weren't getting a lot of information in the investigation. But because we were able to get this started very quickly, our placement team was able to find family and locate family, and we were able to place all 7 siblings with the grandma, who we didn't know about during the investigation. We were just able to find them through the work that was done in the background that may not have been able to be done by the investigator in a timely way of being able to do that. So working together with our placement team definitely made a huge difference for this family, and is a testament that getting placement and ER working together from the beginning definitely makes a difference.
Wow, that is amazing. And I can imagine, I don't know how much you know on this, Stacey, but and Nicole asked a similar question. Obviously, I'm struck by one, it's amazing that you were able to do that and make that's like that grandma is amazing, goes without saying. And then as we're thinking about supports and like the greater network, how once again, presumably grandma, anyone with 7 kids, needs a lot of support. So also thinking about that wider network being able to provide additional help to that caregiver.
Yeah, we have the great grandmother who is already kind of in place. She takes 3 of the kids on Sundays, and she takes she's so cute. She has a schedule, and like every other Wednesday, she takes a different kiddo out for ice cream. So that's her way of being able to help and still be in the children's lives, even though she couldn't help with taking placement.
It's a great example. It goes back to similar to Glenda's previous example as well. Before I move us on, I want to, Sherry, I read out your quote, but I didn't know if you, since you're here, is there anything that you want to share voiceover about and making initial placements or this priority here? Or are you good with sticking in the chat? I just know you, so I feel free calling you out.
I appreciate it. I think I would just add that using the word awareness really speaks to me, because that's something we really focused on when you were with us in Broward County, working on our kinship project, just really getting everybody on the same page. It's something you just can't talk about enough, and you really do need to keep talking about it. And just making sure that everyone knows what resources are available is also really important.
Absolutely. And you don't know this, Sherry, but that is a great tee up for what we're talking about next. But before I move us along, I do want to, we haven't really talked about this final example or point as to why it could really make a difference, but explicitly. But Mariah, I feel like what you previously shared kind of came back to this in terms of, we know that earlier is always better in terms of thinking about building out relationships, and to your all's points around not finding, because family is not missing, but making those connections sooner can really impact the trajectory of what happens in the long run. And I know that oftentimes lots of examples that we hear are from, at the point of adoptions or the point of guardianship decisions. Then there's a lot of family finding work done in order to figure out, have we exhausted all their options? Have we explored all their opportunities? Question is, well, why is that happening then? To Mariah's example earlier, that father wanted to be and could be involved sooner. We just had to make that connection. And so just how the idea of, raising awareness, not just on the importance of kin, but the importance of kin early on, and connecting that story to, direct impact of what happens around permanency decisions can be really powerful, I think, for staff and for other folks. Mariah or Stacey, is there anything, I kind of wove your words through there, Mariah, but anything that you would add? Did I do you justice? And then Stacey, any other thoughts?
No, I mean, I think for us, it's just, keeping that message going that, Kin First placements are the goal and really should be what we're striving to do at, in every situation, and just making sure that that message is staying at the forefront of what we do. I think that's one of the most important things that we've found is helping this continue and really kind of be ignited to make sure that this is our focus.
And that really connects, Stacy, thank you, to what Sherry was saying as well around just the importance of raising awareness and how we think this is often a shift, right? Shifting from single placement mentality to network building and to doing that sooner. And it's a shift for teams and staff who have a lot of competing priorities and a lot of things that they are doing and constantly being asked to think about, be proactive in. And so, when we think about approaches to raise awareness and to continue to build that messaging and to continue to spread that Kin First culture that involves network building from day one, we just like to say, keep talking about it, keep going. I think it's easy to feel discouraged when you have that initial conversation or maybe a training or talking about this, and then it doesn't happen every single time following like that. These things take time. And so we like to say multiple times in multiple ways, reinforcing this and across different settings, different examples, and some of the strategies or tactics that we've seen that really help with this messaging and keeping things on the front of staff's mind is, one, let's not make it overly complicated, right? How can we build in these conversations to existing meetings? Like we already said, we know folks are busy. There's lots of competing priorities, lots going on. So specifically when we're thinking about someone in a management position supporting their staff, can you build in these conversations to your check-ins, to pre-existing meetings, to weekly updates, things that you're already coming together to talk over? Can you build in time to ask about, who are you working with? Have you been able to connect with family or effective kin members for that child and family? How's it going? What can I support you in? And tying that to data and seeing how and whether, you are, as a result, be able to build out more robust networks. That's one thing to track. And then two, when you're looking at your kinship placement data, are we making more kin placements? Are we making more kin placements initially sooner than later? Oh, if we are, what's driving that change? How can we continue to celebrate that growth and intentionality? And then of course, thinking about this isn't necessarily built into existing trainings. Oftentimes, right, this is not historically how we've set up systems and processes. So how can we continue to build in training touch points with all staff, but especially new staff, to get folks off on the right foot, and also think about, addressing maybe preconceptions or concerns or other questions, creating safe spaces in order to have those conversations with how staff are feeling about this, if they're having issues, how to troubleshoot together, just how to continue to reinforce this process. And then I think as we're talking today, all these examples that we just, that I just walked, that everything that we've talked through to this point, walking away, what are you going to remember most? You're probably going to remember that story about grandma taking in 7 kids, right? Like those powerful stories and examples, those stick, making it personal, for thinking about how this impacts children and families, also thinking about how this impacts staff members' processes and how to, talk about shifting things to make the work and effort easier. Both of those can be conversations that you can have to further reinforce why this is important, how it can help. And yes, Denise, I see you said soonest is literally more efficient and reduces worker burnout. That goes exactly to the point I was just making around, yes, not only, most importantly, this is best for the child and family in terms of maintaining those connections. This also really it can change is hard, but making the shift, right, prioritizing these placements, making first placements more often the only placement. Yes, this is actually can be a time saver and more efficient for everyone. And so, yeah, I think there's a lot of opportunities for thoughtful messaging and conversations here. I'm going to stop. Mariah and Stacy, what would you add to this list? Or would you give or any examples about how you're doing this in San Diego with your teams right now?
Yeah, I think for us, what we committed to is at every consultation, this is asked about. So, if I'm consulting with a manager, I'm asking about Ken and possible placement options, even if we're not to that point, it's just a conversation that we're having. The supervisors are having the same conversation with their staff out in the field. So at every level, one of the questions that is there regardless is, what do we know about family? What do we know about support? Have we reached out to them? It's kind of a shift and not just consulting on the safety and risk factors, but it's also consulting on family and what do we know and how can we know more. So, and that's starting from the deputy director level, all the way down to the line staff. Whenever there's a consultation, that is being brought up. Same as in our MDTs, our multidisciplinary team meetings. Placement is attending those meetings now, so they're listening to the consults, and if it kind of feels like it's steering in a direction that's going to be needed, they're in the background sending emails and doing what they need to do to start that conversation too.
That's great, Stacy. And I'm thinking about all these examples since we're talking about messaging around the importance of kin and specifically the importance of kin early on. I know you and your team in the past year have done a lot in terms of specifically earlier and initial. I'm curious if you would share anything in particular in terms of like what you did, what we messaged, what data we showed that made a difference in terms of your staff thinking about, oh, not just kin, but kin early, and what flipped the switch.
Yeah, I think one of the interesting things was the data that we had. Because if you were to ask our managers, they all felt, yeah, we're doing that. We're placing with kin. We're good. We got to just keep doing what we're doing. And then I know Emma had a slide that showed, yes, kin placement, but this was placing first with kin. And we had some work to do. And so it was a reminder that we're striving for the first placement to be with kin. And so that really kind of fueled the want to do better. And then I think another thing that really helped was not putting the tasks on the line worker, because an ER worker who's investigating has a million things that they're doing. We put some of these tasks on to the supervisor to do. And that was even though it was a small procedural thing, it made a big difference because we were able to message, we're all in this together. The worker in the field isn't the one having to do everything. The manager back at the office and the supervisor back at the office, we're emailing templates, we're getting questions answered, we're starting that communication. And so when the worker gets back to the office, they already have this information at their ready to use if they need to. So that's really made a difference.
Yeah, those are great examples. And kind of, Heidi, I know you were joking in the chat, but kind of connects to the famous saying that change is hard. You go first, like thinking about your managers are folks leading by example and saying, we're asking you to do this and we're supporting you and we're doing it too. These are the ways we're going to help get you started, I think, is a great example there. Mariah, what would you add? I saw you coming off mute.
I was just going to add that we do and have begun after our work with GPL, who's so fabulous over the past year. We have been now talking about kinship placements, family finding in more places, right? Like in meetings that we were already having, in trainings that we were already having. We have a mandatory investigations refresher, and now there are maybe 10 slides in that whole refresher that are about family finding and ways to approach, kinds of questions to ask that can build out family connections. We have our SWIT classes, a social worker initial training. So when our new employees come in, they have a whole training period, of course. And in the SWIT classes, we now have a class about family finding and engagement. It is 4 hours long. I don't know why it's so long, but we do have that now, which is wonderful. And so in these places, to Emma's point, where we were already, like folks were already coming together, we've been able to talk more about what it means to find kin and find them early. and what it means to engage family, how we do that, how we build trust or some semblance of trust in our system, to not only find placements for young people, but to also build out their connections for permanent connections and for family support. And I just kind of want to say that, in California, there's been a big effort and a lot of support financially, even to bolster family finding engagement and support initiatives. And so it is this kin first culture is like the key words, the phrase that we've been using is how do we achieve a kin first culture, a kin first culture? And what is culture? What does it mean for you to have a practice that is your culture? It means that it doesn't even feel like this separate or new initiative. It is just a part of what you do. It's just a part of your DNA. Nobody asks, why are we, talking about kin? Everybody sort of knows now. It's a part of our conversations now. And we're still have work to do around that, but that is the goal, to make it so embedded in our processes and in our frameworks, our way of thinking, our approaches, that placing with kin, finding kin, regardless of placement type, it's just what we do. It's just how we operate because we know the benefits, and we've set ourselves up to operate that way. That's the goal. I'm still working on it.
Yeah, I love that was beautifully said, Mariah. And I mean, culture shifts take time. Culture change, it takes time. So continuing to come back to it in new and different ways until, the goal being that this is just, we're not asking why, it just is. And I wanted to, let's see, we have a question in the chat specifically about, since we're talking about data, collecting data to show how identifying or collaborating with kin finder services. Okay, so and Mariah and Stacy, feel free to jump in terms of what we were talking about in terms of looking at data and learning that, actually, we're not as often placing, we being San Diego found, right, together, I've adopted San Diego in this past year, sorry, as I'm saying we, but found out, right, where those initial placement rates, not what folks thought they were anecdotally based off their experience. And so in digging deeper, one way that I think is a really effective approach to understand both what's happening overall, but actually like what's making the difference, how and where are we able to find and place with kin sooner, is we actually paired the data piece with case review and looked in and actually learned, okay, of those who are placing with kin initially, what's happening? Is there, are there certain things? Are we finding more connections? Are we holding meetings sooner? Are these happening in certain places of the county and not in others? And trying to dig deeper to kind of pair those stories with the data points. And then, so we did some of that initially. And then we also, in an ongoing group in which we were piloting some new processes, came once a month to discuss existing cases and talking about, have we placed? Have we not placed? Have we built out the network? And asking those questions. And so in real time, we're having those conversations about identifying like, where was the family finding efforts able to make a difference? What are those bottlenecks that are still existing, right? Sometimes you can try everything and there might be a process thing or something beyond your control. So can we name that? And so kind of thinking about pairing the data piece with ongoing case review and asking those questions, having those discussions as a staff, I think really adds more flavor to understanding the why and how to improve those outcomes overall and add more ownership. That was a very long-winded answer to your question, but I also was going to say, Shireen, would you mind, this is on the fly, but we dropped this at the start, we'll drop it at the end, but link to our different resources. We do have a case review tool to help thinking about, in addition to a data dashboard tool to help you thinking about setting up some of these pieces for your own jurisdictions within. And so you can check those out as well. Mariah and Stacy, is there anything that you would add on the process or what has helped with the data collection piece?
I'll just say that the data does give you a foundation. And to state, which Stacy said earlier, like you really don't know until you know how you're doing. And how will you know that what you're implementing is working unless you have some method of tracking. And tracking is like, really, really indicative of how successful the work is doing. We mostly track initial placements with kin, predominant placements with kin, and we have those disaggregated by age and race and region. We have 6 regions in San Diego. And so those are some of the data points that we look at and track over time to see how we're doing. There are other ways, I think, to your point about like, do we know how many families we've diverted from coming into the foster care system? That's a data point right now we don't track, but maybe something we could think about, because that also shows like how well we're doing as well. So, and that's the point, is to track to see like how well these interventions are working. So something to think about. Thank you.
I transitioned us a little bit more, or I transitioned us to implementation of practices, which I think we're already talking about a little bit in our examples here. And wanted to share a couple ideas or approaches, but also this is a place where we'd love to hear more ideas in the chat or examples of what has made a difference. And some of the things that we've seen here is when you're thinking about, I think this goes back to what we're talking about of continuing to message, continuing to build on this ask and our support of staff as we're making this shift. And so a couple examples of what we've seen keep things at the forefront of folks' mind and feel supported in this shift is building a kin search checklist for staff that is initiated, again, where all of the focus today is early, right? Early on. So this would be initiating something at the referral stage early on, not at the point of what are you doing in the case of removal decision, but actually what are we thinking about in terms of building out that network from day one with every family who we are interacting with, even at the point of just a referral. And this kind of goes hand in hand with talking about how we find it so helpful to introduce or to build in components into existing meetings as opposed to having to come up with something new that feels really different or daunting. And so also thinking about, in things like case handoffs or existing meetings, how are you introducing checks, whether that's just, manager knowing that they are asking X question, or maybe that's in terms of building or a case handoff, building out a protocol to make it clear who is responsible of passing on and sharing that network building information. Where does it live? How is everyone coming back and adding to it together? And then just a general idea. We know that folks are at different points in terms of sometimes you have some jurisdictions have their own separate family finding staff. Sometimes we like to say, if you're working within child welfare, hopefully everyone is a family finder in some way, shape, or form in terms of the support that you're providing. And so tapping those resources sooner than later, if they exist in your jurisdiction, right? Not packaging them or thinking about that role being connected to just removal decisions or adoptions, thinking about how can we pull them in and support sooner. Like Stacy's example, they have a placement team that supports finding connections. And so thinking about how can we pull them in to support the emergency response team earlier so that we may actually be preventing removals. And then also thinking about, this is another example that if we think about making kin placements the true norm, then some jurisdictions have seen success in requiring their local director to sign off for all non-kin placements, right? Establishing that is the not normal option here, the not standard option here. And so in knowing that adds an additional motivation driver initiative to be thinking about building out that network sooner. These are a couple different examples that we've worked on some version in San Diego and seen success elsewhere, not all in one place. So I would love if other folks either in the chat or want to come and mute if you have any other approaches you want to talk about. And then Mariah and Stacy, I'll also pass the mic over to you to add any examples or flavor to what I just shared.
I think, I think something that has really helped is just sharing the success stories, because I know somebody mentioned it earlier, I can't find it, but like the reducing burnout part, when staff are able to place with family, it just feels better, right? Removals are hard. No one wants them to happen. And when we're able to find family and have that first placement with family, it just feels better. It feels better for the kids. It allows our workers to feel really proud of the work that they're having to do. And so it is just good all around. And I think when we highlight the success stories, at least on my team, I've seen the believability increase, if that makes sense. They're like, okay, this is possible and we can do this, and it is worth the extra effort, because at the end of the day, kids are being able to stay with family, and that's what we all want. And I think it's really important to share those successes, whether it be at unit meetings or just in emails that go back and forth, at our all staffs that we have. Those things are important to just highlight the successes so that people can see that this is working, and it is doable, and these are the ways to do it.
And I would just add that I think getting teams in a space to talk to one another, teams that typically wouldn't collaborate or have space or time together. In our case, our ER team, so Stacy's team, and our placement team have had opportunities to build relationships, and you know how important building relationships are, and how something that was hard can be made easier just through a relationship that has been strengthened. And so having opportunities for them to develop a relationship so that they can work together, so that our placement team can take off some of the burden of the family finding. I say burden, but I just mean the task of family finding off of that ER worker, so that they are freed up to do all the other things they can do, and placement teams can do what they do very, very well, that they are trained to do really well. So just creating space for team members to talk and to collaborate, to engage with one another, I think is also important.
Those are really great examples or points, both of you. And I'm thinking, yes, Mariah, always. And then especially, I think we hear this a lot from jurisdictions, that especially since COVID and just the changes that in terms of folks maybe no less like there's been turnover, or just you're not in the office as much as you used to be, different things that might, like you just don't even realize have impacted the sort of relationships, or who you know and who you don't know, and how, yes, collaboration is really key, especially when we're thinking about handoffs and supporting the case or a family throughout the life of our interaction with them. And so yeah, I love that. And also, Stacey, I love, that's going to stick with me in terms of what you said, like it just feels better, or just thinking about kinship, it just feels good or better. That's a really powerful example or reminder of as we think about telling stories and having space to talk and share. These are a lot of great examples, ideas. If you have more, please drop them in the chat as we keep going. I want to turn us to another example of an approach or idea that is a little bit different. And I wanted to pull and share a couple legal examples of how there are jurisdictions or places who are actually introducing or have introduced legislation that promote engaging kin prior to a removal decision. Talk about Pennsylvania and Washington, D.C. I'm not an expert in either of these, and Heidi, our legal expert, our resident legal expert, is here as well, and is going to share a little bit about each of these as examples, just so that you all know that this does exist. This is another route. This is another way to further codify or further formalize this expectation. Heidi, are you great to share a little bit about what Pennsylvania is doing right now?
Sure, I can talk probably more on Pennsylvania than Washington, D.C.
Okay.
I do know Pennsylvania a little better. Pennsylvania has been working for years to be a kin first, they call themselves Commonwealth. So some of their efforts are all the way from law to practice, which is what we like to see. We like to see connecting the dots between law, policy, and practice. So in their law, they are required to do family finding as soon as the child is accepted for services. So those are prevention cases. Those are what they call GPS cases when the child maybe hasn't been removed, but the agency's involved. They are required by law to do that family finding. And there is a court inquiry at every hearing, when it does come to court, about what the agency has done There is something called reasonable efforts, and it's usually reasonable efforts to reunify, reasonable efforts to prevent removal. Pennsylvania has taken it one step further and required reasonable efforts to conduct family finding at every stage of the case. So what we have really seen is, the nice thing is it's not just in statute, it's not just in the court rules. We're seeing that this is actually happening. I will say that it can be a little difficult when you start to delve into confidentiality issues. So if you have a prevention case, if you are working with a family and there has been no legal removal or finding of abuse or neglect, I'm often asked, what are the confidential requirements around sharing with a family when you're reaching out and trying to do family finding? What can you say to that family if the child has not been formally removed? And I say that because if the child has been formally removed, the agency is allowed to explain that the child is in the care and they actually are required to notify within 30 days of that removal. But when a child's not been removed, it's a little gray area. There's nothing really clear about the confidentiality. So although it is in Pennsylvania law that when they're accepted for services, they need to do family finding, we caution and we work closely with the child welfare agencies to be careful about what information they're providing to the family. So when you reach out to grandma or the aunt or the coach, what is it that you're saying about the family's involvement, and where does that sort of bright line lie with regard to confidentiality? So it can be a little complicated, but I think it's a really good model of why it's important to engage family early.
Yeah, that is super interesting. And before I ask you to share about DC as well, I wanted to make sure that I was trying to scour the participants earlier, but if there's anyone from Pennsylvania who wants to speak to this as well, and of course, if anyone has questions, but I wanted to take a second to pause before we move on. Kim,
So,
okay, I'm sorry, go
hi,
ahead.
my name is Angela and I work in New Jersey Child Services.
Okay.
And I think that for me, listening to this practice, here in New Jersey, we have made a major shift and we are trying to work with kin at every level, and engage them at every level. But I think that, with looking at the legislation that's being provided for Pennsylvania, something that I've noticed when working with families, when it comes a referral that comes in to our hotline initially, a lot of families are reluctant to want to give us maybe their family's information because they don't want their family involved in their business, or they'll say that they don't have a relationship with their family. So, it's really about engaging them at all levels, and sometimes it's hard because when we get that initial call to go out to the home, a family is hesitant to want to work with us and our agency in their home. But I have noticed that, like you said, working at all stages of the levels of the case, maybe you're able to pull some layers back and get somebody to be able to reach out to. But it is sometimes hard with families wanting to give us that information.
And I mean, what I would say is, would you hand over all of your family contacts to a stranger who walked up and knocked on your door? So I think what we have to kind of keep in mind is explaining why you're asking. It's not to spread your business. It's not to spread your news. It's to help them create a support network. So the conversation is, who helps you when you're having a problem? Who could we pull in to be supportive for you? That's a different conversation than, I'm required to list all relatives who could potentially be a placement if we need to remove your child, So, and I'm not saying it's a skill. It's an honest to God skill to be able to have conversations and engage a parent who is in a moment of crisis and worried that you're about to take their child. But I think it is worth having that conversation. The other piece I want to mention is, if they say, even after a child's been removed and you have federal authority to do it, you still have to have that conversation. But if they say, don't contact my sister, or don't contact my mother, and we don't get along, etc., trying to understand why, trying to respect it as much as you can, but trying to understand why is it they don't want you to contact certain relatives, and document it, and what can you do if you're involved in that case to kind of work on that relationship between the parent and that kin. I don't know if that sort of answered some of what you were bringing up, Angela, but it's a skill. It's not an easy conversation. I always try to put myself in the shoes of the parent of how would I feel if someone was asking me all these questions.
And I'm glad that you say that, Heidi, because it definitely is a skill set to be able to get in a home and work with somebody that doesn't know you and pull out that kind of information. And not a lot of people have that. So families are hesitant to want to give out that information.
And with regard to this DC law, this is engagement without parental consent. I find it interesting that it's part of their policy and law, because the reality is this is federal law. And federal law is that within 30 days of removal, you have to notify. I think it's that the pending or imminent is the piece that's probably the addition from Washington without parental consent. But again, if you're working on reunification, which every case should be a reunification case from the beginning, a little hard to start off on the wrong foot by saying, I'm going to reach out to that relative even when you tell me not to. So it could be in law, but it's interesting to think about how this would play out in practice.
Thank you, Heidi. Thank you for giving sharing your expertise with us and just giving us a sense or flavor for what's out there, what's being done. And thank you, Angela and others, for that rich conversation. I think also,
if I could add one more thing I'm thinking
oh,
about.
I'm sorry. Yes.
No, I just thought of it. Sorry.
Yes, please.
And that is really, it's everybody's responsibility for kinship connections. And so we talk a lot about the agency's responsibility, but I want to be very clear that it is the court's responsibility, it is the parent's attorney responsibility, it is the agency attorney's responsibility, and it is the child's attorney's responsibility. We really stress to everybody that everybody has a responsibility to keep this child connected to family and to find family. So if a parent's reticent to give names, talk to the parent's attorney, explain why you're asking for names, ask the parent's attorney for help working with their client. So don't forget that all of these parties typically have an attorney. Work with them instead of against them, and explain out people. It goes a long way if you explain the rationale and why you're doing what you're doing. So sorry, that was pretty much my last thing.
No, don't say sorry. Well said. And just brings us back home to the piece of collaboration is key, supporting each other and supporting our families. So thank you. I think that's a great place for us to end. And thank you all for this rich conversation. Thank you, Mariah and Stacy. I know Mariah had to hop to another call, but thank you both for sharing your experience, San Diego. I just wanted to, one final thanks, just encourage folks, if you have other questions or thoughts or other things you're interested in, feel free to reach out to the GPL with additional follow-up or anything we can support you on. And as always, it's been so great to be with you all. I want to pass things back over to Melissa, I'm guessing.
Yeah, great. Thank you all so much for joining us. Those of you who shared your experience, both as a panelist or presenter, and also those of you in the chat. I wanted to just let you know that our last and final session on our Kin Mobilization Learning Community is going to be on March 13th at the same time, and we will be talking about using social media to find kin. So that should be very interesting. I hear we have another great lineup of presenters. So please join us for that. And also just grab from the chat the links that were shared both by Emma and us here. Make sure that you tap into all the resources that we have to offer you. And with that, have a great afternoon. We'll see you in 2 weeks. Thanks, Emma. Thanks, everybody, so much. Appreciate it.
Thank you all.